Achilles tendinopathy. Remember how I talked about during absorption, this is where the tendons absorb all the force so that are going to be used for propulsion. If you're going like this when you're running and your Achilles tendon, the muscle in the back of your leg, is tight, you're not going to be able to absorb as much force as before. You may have to change your gait pattern. So when you go like this over periods of time, instead of going full flexibility of the Achilles tendon, you may start to put some more stress on that area. And when you put stress on the Achilles tendons and other muscles that aren't supposed to be there, you may get some micro trauma or some types of tears or tendinitis in that area. So what do? We work on flexibility of that muscle. Preventatively, we stretch the muscle. And also, during treatment, we try to stretch it as much as we can. We work on flexibility of all the muscles. We work on gradual running programs. Get the patient back to running. Okay? If you start to run and it's like, oh, well, it kind of hurts, then we cross-train. We do the elliptical, the NordicTrack, any type of non-compression exercises to get them back to running pain-free and to gradually work our way back up to running. Some preventative ideas for patellofemoral injuries: cross-train. Strengthen your hips and strengthen your quads as much as you can. Again, adequate footwear. If you have to put extra stress on your hips because your feet aren't absorbing the force, then you may develop patellofemoral syndrome. IT band syndrome. What this is, as Dr. Warren described, it's that band that runs from the hip to the side of the knee. Now, it's a real tight band. Okay? It's not so much a muscle as it is just like a ligament. It's not really, it's there to help, but it's not supposed to be the only thing holding you up. When we talked about going into single leg stance, we talked about the muscle, the abductors holding you up. If those muscles are weak, your hip is going to dip to the side, and that's going to put pressure on this band that we talked about on the side, the IT band. So repetitive things such as running can cause extra pressure on that IT band. So what do we do as physical therapists? Well, we strengthen the hips. Take the pressure off the IT band.